Hi, a very good evening. Just let me check. Very good evening, everybody. I hope I'm audible, I'm visible. If you can get a quick nod, then we can get straight into this session. Yes, Monica. Thank you, Monica, for confirmation. All right. I hope all of you are having a wonderful, wonderful evening. Hi, Nitish, and hope your preparations are going on well, on track. Thank you, Pavitra, for the confirmation. So, as you know, in today's session, what I'm going to do is I'm going to talk to you about, thank you, Ashwarya, about the NEET PG 2024 top topics in pharmacology. Right? So, my stress in this particular session would not be to give you rapid revisions, but it is only to highlight the important topics as of now because we'll be doing the rapid revisions. Hi, hello, Bilal. Great to see you. So my focus mainly right now is to give you those top topics which are must know for you, because obviously we're going to do rapid revisions and series and later on. FMG, okay, if these are top topics for FMG, if you're appearing for FMG, because if there is a next or an FMG which might be in December, yes, definitely this is important for them as well, right? So, and for the current exam, if you're talking about the current exam which is going to be held on 30th of July, then I would recommend, Pooja, that you please follow the videos that I've been taking for the revision, rapid revisions. Okay, so that is much better because now you're going to follow the revision questions. So this session basically is when your exams are at least 6 months later, and you do not forget to lay stress, or you do not forget these topics when you're preparing for pharmacology. That's the whole aim here for this session. Okay, so before I head on to this session, let me first give you some important announcements from the Unacademy platform. So anybody who's interested in taking up the NEET PG Vitals, which are either recorded sessions, right, for all the subjects, 19 subjects, you can go and subscribe on the Unacademy platform for these. These are obviously all the recorded videos, comprehensive videos from all the 19 subjects by all the esteemed faculty. Next, I have this, there is an All India medical test for FMGE aspirants, and this is going to be held on 25th of June from 11 to 4. So, there'll be questions which is like 300 from all the 19 subjects, and you can enroll. It is free of cost, and whoever the top participants or the top students will definitely get scholarships here. Then for the current batch, if you're interested in appearing for the practice tests, right, these mini grand tests if you want to give, then you can avail this very, very good offer of FMG 2023 test series. So it starts from 14 June, has already started till 30th of July. So you can give all these tests, and so that you have a grasp of how to appear in the exam when they finally come. So you'll be practicing as much as you can so that in the end there is no hitch, so there obviously hiccups are there always, but it will help you tone that down. Okay, that is the main aim of giving you more practice tests. So again, this is a very, very, very throwaway price of 1900. So you can just contact these the number which is given and get your subscription for this. Then for the NEET PG 24 or next 23, whatever is there going to happen, there are some batches which are started from 21st of June. They're live on the Unacademy store. So you can get access to that at 7600 only. So again, you have classes and different integration based questions there. So and discussion. So that will be really, really helpful for those students who want to avail this. And yes, now FMG July 2023, this is the final, you can say the final sprint or the final frontier. It is a 1.5 months where these are high yield revision batches. So if anybody is appearing out of you right now in July, you can go in and subscribe to this because again it is a very reasonable price of 3799, and it gets all the important questions, doubt clearing sessions here, recorded content, everything there, so you can revise and recall your all the subjects here. So that will be really helpful to you. All right, so having said that, let's get on to the topic for today, which is your NEET PG 2024 important topics. So mind you, again I'm saying that these topics are very important because they have been repeated time and again, and do not leave these topics, do not skip these topics. That's my main objective of today's session. So first is your general pharmacology. Now from in general pharmacology, let's start, the important, like if I start with the first chapter or the first topic, roots mein, the transdermal patches have been asked again and again. So please make notes of all the drugs which are given by transdermal routes, right? So they keep asking you which is this transdermal patch used for this, hyoscine, rotigotine, which is a recent one, then fentanyl. So all these patches, the names and the indication that you should be well versed with. Then coming to pharmacokinetics, something general pharma is a very high yielding topic in pharmacology. So you cannot general pharma ANS. So please, you have to get your grasp of these two topics. Very important. So kinetics may, the important things is what they ask you is the plasma concentration versus time graph. So they will ask you plasma concentration versus time graph, or sorry, yes, time graph, or they will ask you the, we'll do the pharmacodynamics, the log dose response curve. So all these are important, and the parameters which have been asked, like what is bioavailability, Tmax. So what do they signify? Which signifies the extent of absorption, which signifies the rate of absorption. So make note of that these are the, this is important graph that you should know. Then formulas may, in the formulas as such, we have very often asked loading dose and maintenance dose formulas. So this is the first one asked, this is the second one, form. So this will depend upon what? This will depend on volume of distribution, and this will not depend on the volume of distribution. So whether, because it is, right? So this is the confusion. Loading dose depends on what, and the maintenance dose depends upon what. So please remember these formulas, and this has been asked again time and again. The third thing that you should not leave is the pH. And by pH I mean that what you do when there is poisoning with an acidic drug, what you do when there is poisoning with an alkaline drug. So I'll be telling you in my future when we had the revision classes that for the acidic drugs, you have to make the urine alkaline. For the alkaline drugs, you have to make the urine acidic. So what are you going to use? If you have to make the urine alkaline, so we use sodium bicarbonate. And if you have to make the urine acidic, we can use ammonium chloride or even the vitamin C. So these are very important, is the pH, the role of pH here. Then asked is about the prodrugs. So prodrugs, which are the prodrugs? So example of the prodrugs. Hello Dr. Metroid, good evening. So prodrugs, which are the prodrugs that you should know, the list of prodrugs, and I have a mnemonic for that, that is bad sample, and so you remember all the ampicillin and all the other drugs. Okay, so वो important, एक table है of prodrugs. Then in the metabolism, what is important is, yes, all these, there's a list of those drugs, okay, so remember these. Metabolism mein we have enzyme induction and enzyme inhibition. The examples of enzyme inducers, the examples of enzyme inhibitors. That is important because they ask you, they give you a drug, let's say rifampicin, which is an important enzyme inducer. It is given with some other drug. So what do you do to the dose of that drug? So whenever you're giving an enzyme inducer, you got to increase the dose of the other drug. When you're giving an enzyme inhibitor, you have to decrease the dose of the other drug. So this concept of induction and inhibition is very important. And all this CYP we do not need to know, and there are few important, like the most important is CYP3A4. because this actually takes care of 50% of the drug interactions. So some of these are then 2D16. So these are one or two important cytochromes. Not every we know. So in the questions जो भी exam में from the previous one they have been asked, we are going to pick up those questions and focus on that rather than doing every CYP and doing every interaction. That is not the purpose here right now. Then after this is your sixth is order of kinetics. Very important is order of kinetics. So first order and zero order. Zero order. So here I would say that zero order has been asked more common because first order is common to all, but zero order is not shown by all the drugs. So zero order has been asked quite often. So what is the difference between zero order and first order kinetics? Where there is a constant amount, in first order is a constant fraction, first order the half-life is constant, zero order the half-life is variable. Okay, elimination is variable or elimination is constant in the zero order, variable in the first, clearance is constant in the first, variable in the zero. So ये सारे aspects compare between first and zero order. This is important, and especially examples of drugs which follow the zero order kinetics. And out of this, yes, very good, Dr. Ritu. 0 watt power mnemonic. And which is the pseudo zero order kinetic? Which drug follows the pseudo zero order kinetic like your phenytoin, and which follows completely zero order kinetics like your alcohols? Okay, so this is important. Again, very very important topic to master. And loading dose and हमने कर लिया पहले, which is the loading dose and maintenance dose. Then number 7, I would like to talk about the half life. In the half life, like how many half-lives are required to reach a steady state concentration. Okay, so they will give an example. Then half-life mein there is a drug which was just asked in the the previous exams. So there is a drug which is digoxin was given, half-life was given, and you were asked to calculate like how many hours will the drug go from one particular concentration to the second. So let's say half-life of a drug is 2 hours, and the dose of the drug, which the concentration currently is 8 milligrams. So how much time will be taken by the drug to reach to 2 milligrams? So it will be 8 to 4 and then 4 to 2. So one half-life is 2 hours and the second half-life is another 2 hours. So total would be 4 hours. So this is how you calculate what is the half-life, importance of half-life. So this is another important aspect from this. So pharmacokinetics, please remember these are the must do topics from the kinetics. Let's move on to the dynamics, the second aspect, which is your pharmacodynamics. Now in pharmacodynamics, the receptors, okay, receptors are important. Even the examples, if you can remember for few examples, which one are the ligand gated ion channel receptors? Ligand gated ion channel like nicotinic and GABA A. Okay. Then which ones are the G protein coupled receptors? G protein coupled receptors. That's very important. G protein is very important. And the third will be your tyrosine kinase or enzyme linked receptors. Okay, like insulin we have. And the last one are your nuclear receptors. So starting from top to bottom, they have a lag period. These are the fastest and these are the slowest. The examples of these receptors, absolutely important to know. Then here we come, the very important is dose response curve. Dose response curve or the log dose response curve. Okay, dose response, log dose response curve, and they can ask you about the efficacy, potency. Okay, so there are 2, 1, which out of, let's say this is A and this is B, out of A or B, which one is more potent, okay, which one is more efficacious, so that they can ask you. PDF, I'm not sure if you can get the PDF here, but you'll have the live sessions are always on the Unacademy YouTube channel. ठीक है, in the PDF, in the live section, you can go and you can always, whenever you feel convenient or when you have time, just go through that. PDFs are not available for the YouTube session here. Okay. Yes, no, efficacy is not left-sided. Efficacy, this is potency, because this is a dose. The drug which produces the same dose at same response at a lesser dose, it will be more potent. So potency is the left one, and the height is actually Eiffel Tower या आप height up लगा लो, this is your efficacy. ठीक है, so efficacy is the height and ये potency is towards the left. This is more important here. ठीक है, so ये पूछते हैं which drug or which of them is efficacious or which is has more potency, so that you have to know. Similarly यहाँ पे antagonism also they talk about. Competitive antagonism, right, and non-competitive antagonism. That is also shown. So either there will be a index denote. So it denotes the safety in the population. So therapeutic index, the formula, the mnemonic for that is TILE, T-I-L-E. So therapeutic index is equal to lethal dose in 50% of population divided by the effective dose in 50% of the population. So either it has been asked like this, what is the formula, or they give you a graph like this, okay, and there are two graphs here. So this one is about the efficacy and this is the adverse effect or the toxic effect. So this is the 50% population, so there can be values here like this. So let's say this value here, yeah, ratio. So let's say this value is 20 and this value is 60. So they will be asking you how to calculate the therapeutic index here. So obviously you will divide 60 by 20. That is how you calculate. So it can be asked in this fashion also. So these are some important points about the pharmacodynamics. Then the other important topics are your trials. So in the clinical trials, the phases of the trial, okay, phases of the trials and what they denote. What they denote. Absolutely, very, very important. The phases of the trials and what they denote. Similarly, the drug schedules, schedule H, schedule Y, schedule J, schedule P, all those drug schedules are important to know. Okay, so there's a table given, and if you can go back, and someone who's revising, you can go back to my, we've taken up in the, while we're revising for the FMG students. So in the first revision lecture, I've already covered all these trials and schedules. You can definitely, yeah. Phase 1 is healthy, phase 2 is population which is diseased but very less number, phase 3 is more number, and then the drug comes into the market, that's phase 4 is more post marketing surveillance and adverse effects, everything that you can make out in the pharmacovigilance studies are carried out in the phase 4. So all these are very, very important questions about the phases. Okay, and what do each of them tell you? That phase 2 is, phase 1 basically is more about, you know, finding the doses, the maximum tolerated doses. Phase 2, because it is in the diseased individuals, you can come to know about the efficacy, and the phase 3 will be actually confirming the efficacy. First is exploring, and then it is confirming the efficacy in the phase 3. Then phase 4 is post marketing, where it is into the population. You can study all the kinds of, you know, the rare side effects also come into picture, which were not possible with the previous studies. And there's microdosing studies, phase 0 also, which has been asked, because that is just to phase 0 studies before the phase 1 study, to see if the kinetics are actually of that drug, the new molecule का जो है, जो pharmacokinetic, actually they match with the human, or are they good enough? Otherwise it's a waste of money you're going into the phase 1 trials. Then schedule H. So these are different from the category. Okay, so drug category and drug schedules are different things. Drug category हम usually we talk about in pregnancy. ठीक है, so उसमें है A, B, C, D and X. ठीक है, so this is about teratogenicity, like the last one, these are your teratogenic drugs, and this is very important, another table which is very, very important to know. What are the various teratogenic drugs? and what teratogenicity do they actually cause, whether it is warfarin hai, statins hai, phenytoin hai, valproate hai. So all these important list of drugs are your teratogenic drugs. So drug category is very, very important, and make sure that you don't confuse it with drug schedules. Drug schedules are different and the drug categories are different. Right. All right. Then coming to the next topic, which is your autonomic nervous system. So autonomic nervous system, we have two. Here we have your sympathetic and the parasympathetic. Okay. So as I said before, both are equally very, very important, and ANS as such, whole ANS is very important because the receptors, alpha, beta receptors, muscarinic, nicotinic receptors, which drug acts on these receptors, what they do, everything is very important here. Okay. And Dale's reversal phenomena has separately I've mentioned, because vasomotor reversal of Dale, which you get, like suppose this is the effect seen with a high dose of adrenaline, and if you give an alpha blocker here, let's say phentolamine, and then you again repeat adrenaline, because phentolamine is an alpha blocker, and this is called as the biphasic response. Okay, biphasic response hai, which is because of alpha 1 receptor here, and this one is because of beta 2. So when you give an alpha blocker, this response is going to be blocked. So we will not be able to see this response. So again, if you repeat adrenaline here, there is only fall in BP seen. So this is called as vasomotor reversal of Dale. So these are important. They show you a graph and they ask you to identify, or they will ask you what is Dale's reversal phenomena. Then I said receptor and its actions, all receptors, and which drug works on alpha. As I said already, you have to know these. Agonists, antagonists, okay? So agonists, antagonists important, antagonists rather are more important. Agonists also there, so alpha blockers, beta blockers. Re-reversal, yes, they ask if you give a beta blocker also, then you can, there'll be a re-reversal, but currently in original books it used to be this phenomena. Now we don't use this phenomena. So if you give a beta blocker also, then there'll be real re-reversal phenomena. So agonists and antagonists again here, as I said, so please make sure that you remember all the important agonists and antagonists of all these receptors, and I'm repeating, we are going to practice them later, but when you are doing these, so please remember for the alpha, especially the use of phenoxybenzamine, phentolamine, where they are used, pheochromocytoma, which one is used, which is used in clonidine withdrawal, which is used in hypertensive crisis. Okay. Then if I talk about the beta 2 agonists, which are used in bronchial asthma, they have been asked time and again what are the specific adverse effects. So all of them. So as I said, ANS, please don't leave anything in the autonomic nervous system. It's very, very important. Then diseases I will give you in the end also a list of diseases which are must know, but still let's do this here. So in the autonomic nervous system, very, very important, very, very important, as I said, it is glaucoma. I can give 4 stars to this disease, glaucoma, asked a lot of times. Then anaphylactic shock. So anaphylactic shock, basically what is important is that how you give, like you give adrenaline, okay, 0.5 that you give 1:1000 by IM route. So this is important. So how you give adrenaline. Then it is important is your which drug is used in myasthenia gravis. It's basically the drug treatment. Okay, drug treatment. Yes. What is used? Neostigmine in myasthenia gravis. We don't use Physo, we use neostigmine here along with neostigmine के साथ atropine. ठीक है? Then organophosphorus poisoning. Yes, pybrostigmine also can be used. Organophosphorus poisoning, and where the antidote you have atropine. ठीक है, so atropine is an antidote here, you use this. Organophosphorus poisoning में carbamate, or what is the difference between this and the carbamate poisoning. Then pheochromocytoma. Pheochromocytoma. Management of pheochromocytoma. Treatment of obesity. Drugs only, details are not required. The drugs used in the management of obesity. Then the drugs used for smoking cessation. So as far as I remember, these are the important drugs or the diseases that you should know about फ्रॉम ANS पॉइंट ऑफ व्यू, ठीक है. ANS में ये सारी इंपॉर्टेंट है. या ऑलराइट, लेट्स गो टू द next topic, which is your respiratory system. And respiratory system is an autocoids. Respiratory system is all about bronchial asthma. So management of bronchial asthma, what you give in the acute attack, what you give for prophylaxis, ठीक है. Prophylaxis, role of beta 2 agonists, very important, ठीक है. Short acting and long acting. Yeah, and adverse effects. So beta 2 agonists के adverse effects they have been asked quite a lot. Which of the following is not an adverse effect? Usually what they do, they tend to give you something which is not there. So they will ask you which of them is not an adverse effect of beta 2 agonist, right? Okay, so they will give you that kind of question. Prophylaxis. Then migraine, another very very important disease from this autocoids. And which is the drug used for acute, and which are the drugs now which are approved for prophylaxis, ठीक है. acute के लिए triptans are the drug of choice, and prophylaxis may we use the beta blocker. Hi Pratik. So prophylaxis के लिए we use the beta blocker. So there are other drugs also. Acute mild अगर attack है, then we use NSAIDs. If it is like for mild attacks, we can use NSAIDs, but if it is not getting, corrected by NSAIDs, then we go on to the triptans. So for severe, it is actually triptans, you're right. For mild to moderate, if they're responding to NSAIDs, then definitely we give NSAIDs. Then gout. So again, gout, you have to know the drugs which is given for acute attack or acute gout or chronic. ठीक है, acute and chronic. All the drugs for this very very important. ठीक है. So acute है या chronic है, कौन सी drugs हम दे रहे हैं. Similarly, disease में rheumatoid arthritis. So drug of choice हम जैसे हम देते हैं methotrexate which is given, and which are the other drugs which are given for this. And please remember, mechanism of action of the drugs, very important. How the drug is benefiting in that disease, that is also important. Just remembering the name of the drug will not be, because they will sometimes they will not directly ask you just the name. They will say that this particular drug which is beneficial in patient with rheumatoid arthritis, it works by increasing the adenosine action. So if you don't know the mechanism, you will not be able to answer. So mechanisms, please make note that they are must know in pharma. How एक तो classification में which drug acts here, yeah, the marks though it is just the group of drugs, but how they act, every drug will act in a different manner. No, you need to know the mechanism therefore. So please don't skip the mechanisms. ठीक है, that is important. Then aspirin के बारे में, so aspirin where the aspirin is used, and salicylism, ठीक है, and aspirin, which is the poisoning, what is the treatment. So here, because aspirin is an acidic drug, so you can give sodium bicarbonate. So poisoning with aspirin, what do you give? Similarly, acute paracetamol poisoning, N-acetylcysteine देते हैं. What is the antidote for acute? So they will give you a question like a child, he has swallowed maybe 50-60 tablets of paracetamol. Now how are you going to actually treat this child? So there will be options given in the different like options will be, and you have to select the antidote. So again, I'll be giving you a list of antidotes when I'm going to take your lectures here on the YouTube, and please mark those who like ratta जैसे कहते हैं ना, just remember those antidotes because they have एक दो तीन, I mean so many times, even I've forgotten the atropine poisoning, the Datura poisoning, ठीक है. Antiplatelet, aspirin is an antiplatelet drug, ठीक है, not thrombin, antiplatelet कहते हैं उसको. So it works by inhibiting the COX enzyme. Yes, you're right. In the low dose, it works in a low dose as an antiplatelet drug. ठीक है, so I'll give you. So atropine जैसे मैंने बात की, atropine is the drug which it is from the plant, जैसे Belladonna datura, so उसकी poisoning. So all antidotes, I'll be giving you a list of those antidotes, and you can just revise from those antidotes because they are very very important. So ये because these are scoring questions which you cannot miss. ये easy questions हैं which we are not supposed to miss, जो antidotes वाले हैं. Yes. So aspirin is also an example of a hit and run drug. As you Akshay says, irreversible. So these are irreversible inhibitors of COX enzyme, also called as hit and run drugs. Hit and run drugs होती हैं जो एक बार किसी को hit कर देती हैं, and then the जहाँ पे जिसको hit किया, that is gone forever. So new enzymes they have to be synthesized. ठीक है, so it's an example of hit and run drug, just like proton pump inhibitors. Coming to the next important topic is your cardiovascular system. Now, cardiovascular system, again, a very, very big system. And these are few drugs which have been asked. The nitrates, okay? So, and as I said, please, it goes without saying mechanisms are a must, to understand and to know. Whether they decrease the preload, decreases the afterload, how is it beneficial in angina, whether it is beneficial by decreasing the preload, whether it is beneficial by decreasing the afterload, whether a drug is beneficial by decreasing the cardiac work or myocardial oxygen demand. So jitne bhi drugs that you're using for angina or any of these diseases, you should know how they work and how they are helpful in these patients. So that's what I'm saying, mechanism without me saying it again and again. Please make a note of it that you have to know the mechanism, because when you'll go through the question, you'll yourself know that mechanisms ke bagair you are not able to answer the questions. So similarly for nitrates, okay? So nitrates are another mechanism. Then the adverse effects like Monday's disease and the hypotension. Then that it should not be contraindicated to be mixed with drugs like sildenafil, okay? Because they work with the same, yeah, anti-anginal drugs, okay? So which of the drugs are good for variant angina, which are the drugs which are good for you can say the classical angina. So classical angina agar prophylaxis ki baat kare, because nitrates are the given in acute attacks, and yes, it depends actually what type of angina we have. So even if you decrease the load, or you can decrease the myocardial oxygen demand also in patients. Yes, it's a potent venodilator. Excellent, Ritu. Yes, all of you are correct. Then similarly CCBs. CCBs पूछा जाता है. CCBs के बारे में like especially verapamil, diltiazem and the dihydropyridines. So what is difference in these? Which is verapamil क्या करता है? Verapamil, diltiazem more effective on the heart, and जो dihydropyridines they have effect more on the blood vessels, so they are better for using in जो heart में अगर हम use कर रहे हैं, so we better use verapamil, diltiazem, and if you're using only for the vasodilatation of the blood vessels, then we use dihydropyridine. So important is that. Then verapamil, they are depressants, myocardial depressants. They should not be combined with beta blockers, but you can combine the dihydropyridines with beta blockers. So these are some important pointers that you are supposed to know. So CCB is another very important group of drugs. Digoxin is supposed to be एक ऐसा ड्रग है जिसको हमने रट के पी के चले जाना है, ठीक है? डाइजॉक्सिन के बारे में each and everything, ठीक है? Yes, ACE inhibitors. Yes, when I talk about ACE inhibitors, Ritu, I'm going to talk about that also. Digoxin is one drug. Another, it is such a favorite of the examiners, and it has been asked in one way or the other. Okay? Though it is not much used now, but still it is a favorite of the examiner. So we have to know each and everything about digoxin. Okay? So what is the mechanism? Yes, what is the mechanism? What is the adverse effect? How we treat the adverse effect of digoxin, everything that. So all the arrhythmias which it causes, how we treat if digoxin toxic. Yes, it is only one part. If it is severe toxicity, then we give digibind. But what you give for digoxin induced ventricular arrhythmias, what you give for digoxin induced AV block, okay, what you give for digoxin induced atrial fibrillation. So we have different antiarrhythmics for this. Okay? So therefore, everything about digoxin you have to know. Which is the most common adverse effect with digoxin? Which is the most common non-cardiac adverse effect with digoxin? So this is the drug which is the therapeutic levels, which are the safer levels. It is a very drug, yes, Pratik, short acting use for treatment, long acting use for prophylaxis. Yes, excellent. And digoxin, as I was saying, that everything and anything is very important for this. So ये आपको each and everything. So जब आप MCQ solve कर रहे हो, please, you will see that every little bit about digoxin has been asked. So what are the therapeutic levels? It is a very good drug, which is a candidate for therapeutic drug monitoring, which is a very narrow therapeutic index, everything. Then antiarrhythmics. Now antiarrhythmics, what I would ask you to do is that you do the classification basically, because in the classification it will be evident, like mechanisms is evident in the classification. So जैसे हम करते हैं, if I tell you a mnemonic is that we remember sodium beats potassium, calcium. Okay, so the first group is a sodium channel blocker. The second one are your beta blockers. The third ones are your potassium channel blockers, and the fourth one is your calcium channel blockers. So if you remember this mechanism, so obviously you will come to know that which, so here you have to remember the classification, which drug belongs to which part, 1, 2, 3, 4, and how are they going to act, which is going to block the sodium, because mechanism पूछेंगे तो classification itself is the mechanism of action of these drugs. Then so this is one part, you should know the classification very well. Not all drugs I would advise you to do, but at least amiodarone and adenosine. Okay, amiodarone, adenosine, very very important drugs. Amiodarone, adenosine, very important drugs. And in the end, treatment of arrhythmias. Which drug is given for atrial fibrillation, which is given for ventricular fibrillation, ठीक है, Wolff Parkinson. So एक table with the drug of choice, ठीक है. So एक table with the drug of choice. So amiodarone में very very important actually are its side effects. Asked time and again, whether it's the blue man syndrome, pulmonary fibrosis, corneal microdeposits, सब कुछ पूछा गया है amiodarone. So side effects definitely are very important, and adenosine is the drug of choice for PSVT, so that you should know. SSC SSC, I don't know. SSC, what is your topic? SSC means, yeah, blue baby नहीं है, blue man syndrome है. And don't confuse with gray baby. Gray baby is chloramphenicol, blue man syndrome is amiodarone. ठीक है, so gray baby है, blue man है. SSC college. If this is your actually these are pharmacology. If I am not sure if pharmacology is your topic. If pharmacology is your topic, then definitely it will be helpful. So you can actually just check if this suits you. I have no idea about that, right? Okay, ACE inhibitors. Another very very important topic is ACE inhibitors. So ACE inhibitors, which are all your prils. ठीक है, ये बहुत important topic है. Mechanism, adverse effects, especially cough. ठीक है, because this is a drug group which causes dry cough, and अगर dry cough हो रही है, we have to replace it. We have to replace with angiotensin receptor blockers, and cough is because of increase in the bradykinin. All right. So bradykinin. So increase in the bradykinin levels that lead to cough. ठीक है. So cough is a very important side effect with ACE inhibitors, and ARBs definitely are an option when ACE inhibitors cannot be given. Then another important thing, ACE inhibitors, this is a very, as you rightly said, it is a teratogenic drug. ठीक है, absolutely contraindicated pregnancy, as are the ARBs. So we never give ACE inhibitors in pregnancy. So when it causes hyperkalemia, so never to be combined with drugs which increase the potassium levels like spironolactone and potassium jitne bhi supplements hai, we should never give them. Then so everything about ACE inhibitors. So Raja, I would tell you that drugs acting on the renin angiotensin aldosterone system, which are your beta blockers, renin inhibitors, ACE inhibitors, ARBs, yes, very important, ARBs, and aldosterone antagonists. ठीक है, तो ये सारी drugs हैं which are acting on the RAS. And so in the FMG, if you remember the last one, they had given you a picture of this renin-angiotensin system, and they had showed an arrow and pointing out to the one of the drugs, and they asked you which is the mechanism of this particular drug. So it can be asked even in the NEET PG. They will show you a diagram of this RAS, and anywhere they can mark an arrow and ask you which of the drugs they will act at this particular site. So important, renin-angiotensin aldosterone system. Then hypertension, more important actually for hypertension is use of various drugs. Which are the drugs which are currently given for hypertension? Because already mechanisms are known to you. Here basically you should know which are the drugs of choice for hypertension, which is your ACT. Okay? Beta blockers no longer the drug of choice. So ACE inhibitors, ARB, calcium channel blocker, and thiazides. So these are the first line drugs. Okay? So what is the regime here? And hypertension in special situations. Hypertension in pregnancy, hypertensive emergency, hypertensive urgency. So drug of choice, for example, hypertension in pregnancy, we prefer labetalol. If hypertensive emergency, drug of choice is nicardipine. Hypertensive urgency, then it is clonidine. Yeah. So hypertension in special, so hypertension, if it is in a patient of BHP, you give prazosin. Okay? So hypertension in a case of like migraine, you can give beta blockers. So yes, that is the way they can ask you this integrated question. So patient को दो चीजें हैं, which one? And remember, beta blockers, अगर they can give you hypertension भी है, and the patient has bronchial asthma, which of the following drugs will you not give? So उसमें एक option होगी beta blockers. So beta blockers are never be given in a patient who has bronchial asthma. Any in the question you find bronchial asthma written, so be sure that beta blockers तो नहीं देंगे उसमें, right? Yeah, tamsulosin is basically if there is only BHP, but if it is a hypertension associated with BHP, because what tamsulosin does, it acts on only the alpha 1A, which is mostly present in the which is only going to benefit the BHP. But blood vessels may it is alpha 1B. So if it is a hypertensive case alongside, then you have to give prazosin, which works on both alpha 1A and alpha 1B. Okay. Then phosphodiesterase inhibitors, examples सिर्फ याद करने हैं, ठीक है? Only examples, no details, like phosphodiesterase 5 है, 3 है, 4 है, indirect, what do you call that, non-selective ones हैं, so sildenafil like group है, milrinone है, ठीक है? Silastazole, dipyridamole, theophylline, so just list of these drugs. Diuretics, I'm coming later, diuretics also I'll come. ठीक है? So this is a exhaustive list of CVS here, alright. Let's go to the next one. Then we have blood and hypolipidemic drugs. Okay, blood and hypolipidemic drugs. So blood में your antiplatelets, very important. Again, mechanism of the various antiplatelet. So whether it is your aspirin, whether it is your this what do you call GP2B3A inhibitors, whether it is your ADP receptor P2Y12 inhibitors, and ये सारा important है, and you need to know the mechanism. ठीक है? So all this, yes, allogeneic is renin inhibitor, absolutely true. So antiplatelets का mechanism is very very important. Aspirin, clopidogrel, ticlopidine, epsiximab, eptifibatide, all these drugs are there. So classification of antiplatelets very important. ठीक है? So ये आपका एक important topic है from the antiplatelets. Then heparin, oral में heparin, anticoagulant, oral anticoagulant heparin, mechanism inhibits factor 2 and factor 10, but it is indirectly, ठीक है, via antithrombin 3. So this is mechanism of action of heparin, and you know that heparin is a drug which is safe in pregnancy. Warfarin is contraindicated in pregnancy. Contraindicated in pregnancy, and heparin is safe in pregnancy. ठीक है, ये important चीज. Then difference in low molecular weight heparin, factor 10 inhibition more than factor 2. Fondaparinux only factor 10. ठीक है? So ये आपके mechanisms. So again mechanisms are coming everywhere. These are your mechanisms for this one. उसके बाद warfarin के बारे में and their antidotes. Warfarin के बारे में contraindicated mechanism of action is inhibiting factor 2, 7, 9 and 10. ठीक है? All the vitamin K dependent factors 2, 7, 9, 10 and antidotes. Antidote for warfarin is your vitamin K. For heparin you have protamine sulfate. Protamine sulfate. ठीक है, ये इंपॉर्टेंट हो गया अबाउट हेपरिन एंड वॉरफरिन. सो ये है which is the drug of choice. So if there's a pregnant lady comes and she has to be given one of the anticoagulant, which one will you choose? It will be heparin and not warfarin. And warfarin has a lag period. Heparin is very quickly acts by subcutaneous route, and warfarin is oral, but it has a lag period because it cannot work on the already synthesized vitamin K dependent factors like 2, 7, 9 and 10. Then statins, most important from the hypolipidemia statins. Again, their mechanism of action, adverse effects and their use. Very, very important. And there's a list of new drugs which is hypolipidemic drugs. ठीक है, list of new drugs है, and that I'll be telling you later in the subsequent my sessions, and these are important because they have been asked. Just the mechanism is asked there and you have to name the drug. So list of new drugs which are your hypolipidemic drugs. ठीक है. Now diuretics, as I was talking, someone was talking about diuretics. Now diuretics is a very important topic as a whole. कोई भी type of diuretic they have been asked, especially they will ask you so whether it is your loop, whether it is your thiazide, ठीक है, whether it is your osmotic, or loop I will write carbonic anhydrase inhibitors, and whether it is your aldosterone inhibitors, antagonist rather, or potassium sparing diuretics, सारे के सारे are absolutely must know. So they can be given in the form of a diagram. So they can be like, this is your PCT, ठीक है, and the loop of Henle. Again, this was asked in this FMG, distal convoluted tubule, ठीक है, and here. So यहाँ पे they will ask you which diuretic acts here, which diuretic acts on the ascending loop of Henle, which diuretic acts on the early distal tubule, which diuretic acts on the collecting duct. ठीक है, so you know that carbonic anhydrase work here and inhibitors. Mannitol works as osmotic diuretic in the PCT as well as the descending limb. ये है loop diuretics. These are your thiazides, and these are your potassium sparing or aldosterone antagonists. Yeah, yes, absolutely. So ये सारे diuretics के बारे में the target site is important, and then their adverse effects, ADRs, very, very important. So especially a loop or actually thiazides में there's a confusion, which one loses calcium, which one retains calcium. So thiazides retain calcium and loop is going to lose calcium. So all these are important regarding that. Osmotic diuretics, where they are used in the cerebral edema, contraindicated in the pulmonary edema, and used in the dialysis disequilibrium syndrome. So if you remember in the NEET PG it was asked dialysis disequilibrium syndrome में which is the drug which is used, and it was your mannitol. So diuretics के बारे में this is more important, and antidiuretics में only it is the vasopressin. Just you can know the name of the drugs and the uses. That's it about the antidiuretics. Coming to the central nervous system, another important topic is central nervous system. So the first chapter which is very important is your anti-epileptic drugs. ठीक है, anti-epileptic drugs. So यहाँ पे मैं again I'm generally focusing mechanisms are very, very important. They have a lot of tendency to ask you about mechanisms. And which are the drugs of choice for various types of epilepsy? Grand mal epilepsy, petit mal epilepsy, absent seizures, infantile spasms and all that. So what are the drug of choice for various types of epilepsies? And all the, if there are newer drugs, we'll be covering those new drugs also. No, modafinil is not used. Modafinil is for narcolepsy. Modafinil is a drug of choice. It is used for narcolepsy. Side effects में these two drugs are very important. Phenytoin and valproate. Very, very important to remember because these are highly teratogenic drugs. So these are very important to know as a whole because of their side effects. Benzodiazepines. Benzodiazepines, usually what they ask you, again as I said, the mechanisms of action. तो जब आप करोगे anti-epileptics में it will always be their mechanism of action. Drugs safer in liver disease. the lotte drugs, ठीक है, LOTE, which are safe in all the benzodiazepine which are safe in, yes, very good. And which is the antagonist for benzodiazepine toxicity? It is your flumazenil. Very important, ठीक है. Methanol poisoning, alcohol de-addiction, opioid de-addiction, all of this you have to know. Which is the drug used for each of these? Methanol के लिए कौन सी यूज करते हैं, alcohol de-addiction के लिए कौन सी यूज करते हैं, which decreases the craving, which decreases the you can say the adverse effects and everything about alcohol as well as the opioid de-addiction. So we ये तीनों all of them are very important. De-addictions are very very important topics. Then coming to the anti-Parkinsonian drugs, so all for mechanisms, yes, you have to know the mechanisms, and especially the levodopa group. You should know levodopa, as I said, the mechanism. Then you should know its drug interactions, how it works with carbidopa, which vitamin is not to be given when we are giving levodopa, okay, and on-off phenomena, which drug is beneficial. So again, this is very very important. Then in the antipsychotic, basically I found this EPS has typical antipsychotics. They are causing EPS. So what is the treatment for EPS and what is EPS? That you should know. Atypical antipsychotics में clozapine is a very very favorite topic. Very important drug. So इसके बारे में you should know everything. Sometimes they ask you about the wet pillow syndrome. Sometimes they've asked about the agranulocytosis or the metabolic syndrome. So lot of times question on clozapine has come. So it has an overlap with the psychiatry also. Psychiatry में भी आ सकता है as a part of pharmacology. So that ways, ठीक है. Then it is about lithium and one more thing here, antidepressants. अगर हम बात करेंगे antidepressants की, so इसमें SSRIs are important, ठीक है. SSRIs are important. The adverse effects of SSRIs. Lithium, just as I told you about digoxin, same thing goes for lithium. This you have to mark the whole thing about lithium and just इसको पी जाओ घोल के जैसे कहते हैं. So because it has a narrow therapeutic index, it is a drug of choice for it is used for mania, ठीक है. And what is the mechanism of action in mania? Yes, very good. Epstein anomaly can occur if it is lithium. So it is a teratogenic drug. So you have to remember its teratogenic effect as well. So ये सारा lithium के बारे में, ठीक है. You should know everything about lithium. That is about your CNS. Let's go to endocrinology now. Endocrine system में anti-thyroid drugs. Not important much are the thyroid hormones are not as such asked, but anti-thyroid drugs are asked. ठीक है, anti-thyroid पे ज़्यादा stress देना है हमें. So which is the classification of the anti-thyroid drugs you should know. ठीक है, so especially the thiamides and the quickest acting is the iodides. Then we have radioactive iodine, right? All those propylthiouracil, and these are the drug of choice. PTU is a drug of choice in pregnancy. अगर first trimester में देना होगा, so we will prefer PTU. Carbimazole, methimazole is given in the second or third trimester because of the tendency of being teratogenic. ठीक है, yeah, cutis aplasia and or Condlet. Yes, it is used for pregnancy. First trimester में, second, third में you can also give carbimazole. But if they ask you which is the drug of anti-thyroid drug of choice in pregnancy as such without mentioning the trimester, then you mark PTU. अगर trimester mentioned है, then you can mark definitely any of them. But अगर trimester is not mentioned, then please you mark PTU only. ठीक है, so this is about the anti-thyroid. Anti-diabetic drugs. Now currently a lot of focus has been on metformin, ठीक है, SGLT2 inhibitors, GLP analogs and DPP4 inhibitors. A lot of questions have been asked on these 3 or 4 drug groups, but what I advise is that you should only not go with the question asked. The topic becomes important. Agar they have asked you about a particular anti-diabetic in one paper, there is a tendency they will ask you about some other anti-diabetic in the next paper. So for that I meant to say is the whole anti-diabetic drug. The concept of if they're asking you about metformin in one paper, they can ask you about sulfonyl use in the other papers. It doesn't mean you only have to do these 4. You have to do all the anti-diabetic drugs. And again, I'm repeating this so many times, mechanism of action, important adverse effects. Mechanism of action, important. Yes, adverse effects. You have to know, and then they ask you about the weight, which anti-diabetic causes increase in weight, which causes decrease in weight, which is weight neutral. What are the other uses of anti-diabetics, if they have any, like metformin is used in PCOD. So that is the kind of question they can ask you again. Okay, and then insulin. Insulin, which is the short acting insulin, which is the long acting. Mostly a question is asked either about short or the long. तो extremes के बारे में पूछते हैं. The intermediate they don't ask much, but yes, as I said, the question is not important, the topic becomes important if that has been asked. So anti-diabetic chapter as a whole is very important. So you should know the classification. Okay, so you should know the classification of the insulin and then the adverse effects. Okay, classification and the adverse effects. Then from the female sex hormones, anti-estrogens have been asked time and again, which are your selective estrogen receptor modulators basically. More of that has been asked. Okay, and you should know the names, whether it is your selective estrogen receptor down regulator or whether it is your selective progesterone receptor modulator. उनके नाम ज़रूरी हैं, but about the SERMs you have to know the names as well as the uses. OCPs, which are the drugs that are used as OCPs, what is the constant of OCPs, that is more important, more details, and the side effects. Okay, constituents and side effect. Then another one here I will mention is mifepristone, which is used for medical termination of pregnancy. Has been asked mifepristone with misoprostol or Gemiprost. Okay, so for medical termination of pregnancy, how it is used. Then osteoporosis, parathyroid में से osteoporosis important है, and especially they ask you about bisphosphonates. First generation, second generation, third generation, what are the side effects, what is the mechanism, and which of the drugs used for osteoporosis, which one causes increase in the activity of the osteoblast, which reduces the activity of the osteoclasts. So that also you should know from this. Alright, so this is endocrinology. Coming to GIT, GIT में सबसे ज़्यादा important is your peptic ulcer. ठीक है, peptic ulcer, most stress on peptic ulcer, especially your PPIs and H. pylori drugs. ठीक है, PPIs के बारे में again mechanism of action of the PPIs and side effects a little bit, and that these PPIs they're also called as hit and run drugs. ठीक है, target site हमने कर लिया and hit and run drugs. Yeah. Antiemetics के बारे में this is more important actually when we do anti-cancers में हम करेंगे. So which of the drugs are used for specific anti-cancer, nausea or vomiting. So especially the 5-HT3 antagonists. These are more often asked. Which are the following drugs which are given. So फिर कौन सी delay toxicity में, कौन सी early toxicity में use करते हैं. So that kind of questions have been asked from this. So GIT, I think this much at least you should touch. Then general antimicrobials. Coming to the chemotherapy part now, general antimicrobials. General antimicrobials के बारे में again mechanism. So they can give you a diagram asking you about the mechanism of any of the antimicrobial drugs. So whether it will be a cell synthesis inhibitor, or cell membrane inhibitors, okay, or they'll inhibit the protein synthesis or the DNA. Okay, जो सारी classification, all the drugs which are affecting different, they are targeting different points on this or different target sites. Please remember the mechanism of action. So whether all your sulfonamides, aminoglycoside, tetracyclines, chloramphenicol, macrolides, all of them, they fall under the general antimicrobials I'm talking about. Quinolones, okay? So drug of choice. So when you do these groups of drugs, you will see in their uses which one is a drug of choice for which condition. So ठीक है, so those drugs of choice very important in pharmacology. तो आप एक list of you can make a list of drugs which are, the drugs of choice for various conditions. That would be very, very beneficial, because towards the end, when you have to go and appear for your exam, you can just flip through that list and see the कौन सी drugs are, the drug of choice for this particular disease, because that is something which you can forget, volatile है. तो towards the end you have in one page or 1, 2 or 3 papers जो आपके sheets बनेंगे, all the drugs of choice to be noted there. Antidotes और drug of choice, ये दो चीज़ें हैं that you should have on a list, so that when you go before the exams, you can just quickly flip through that and not waste time flipping through the books. Then ADRs, ठीक है. So typical adverse effects, like I said, gray baby syndrome है, aminoglycosides, nephrotoxicity, ototoxicity, neurotoxicity, ठीक है. So जो typical very classic side effects हैं, you should know about which aminoglycoside causes what, ठीक, or which antimicrobial general वाले they cause what. That is very, very important to know. Then specific antimicrobials. If I'm talking about specific antimicrobials, what is more important in this? It is your anti-TB drugs. Very important. First line, very, very important. ठीक है. So first line drugs जितने भी है, PERI. S is not a very first line, just secondary. So pyrazinamide, ethambutol, rifampicin, isoniazid. So mechanism, again, iska diagram has been asked before, and they give you the diagram and they put an arrow and ask you which drug is acting by that mechanism. So that is important. Pyrazinamide, ethambutol. So which is safer in renal disease, which is safer in liver disease. What is the toxicity cause? Peripheral neuropathy कौन cause करता है? How can you prevent that? So all these questions revolve around this. Which is an enzyme inducer, which is an enzyme inhibitor. So again, these first line are very, very important. Anti-leprosy, only the regime actually is mostly important. The regime, which is same whether it is now, the drugs are same, whether it is your multibacillary, paucibacillary, only difference is in the duration. Otherwise, the drugs, it's easier now, it is to remember, the drugs are almost the same. Then if I talk about the other important thing here is your antifungals. Antifungals. Again here, the drugs of choice. Various fungal infections and drug of choice. More important, along with mechanism. Please don't forget this. Mechanism पूछा जाता है, and which is the fungal infection, which is the drug of choice for that. That has been asked. Anti-amoebic में amoebiasis is very important. Amoebiasis. ठीक है. So drugs used for amoebiasis like metronidazole and like drugs, and disulfiram reaction with metronidazole, drugs showing disulfiram like reaction. Those kinds of actually questions have been asked. So amoebiasis is very important topic. Antihelminthics. Again, which kind of helminthic infection, what is the drug? Mostly it is all about that. Which kind of helminthic infection and what is the drug used? Then viral, antiviral drugs. Antiviral drugs maybe you will be asked about the infections and what are the drugs. So mechanisms of the important drugs like acyclovir and all, and where are they used? Drug of choice कहाँ पे use करते हैं, that is more important. Antiretroviral. Again, remember the picture the mechanism, ठीक है, picture the mechanism. Yes, which is, that is for like influenza. अगर influenza के बारे में पूछते हैं आपको, management of influenza, then you can write. So antiretroviral drugs. So again, you picture that diagram of mechanism. Mechanism का diagram, please remember. So what are the drugs acting on what site? This is very important. Yes, all of them. They again have shown you, this has been asked before, they have given a diagram of the various antiretroviral targets, and they put a particular target marked with an arrow, and they ask you to identify which antiretroviral or antiviral drug acts by this mechanism. Therefore, I said you have to be very well versed with the mechanisms. Then antimalarials. ठीक है, for prophylaxis के लिए कौन सी यूज करते हैं? And management of malaria, treatment of malaria. ठीक है, so it is the treatment of malaria. So malaria में आप क्या यूज करोगे? Whether it is your chloroquine sensitive है तो chloroquine resistant है, cerebral malaria, the treatment modalities are very, very important here. ठीक है. So this is just a brief overview about these drugs, antimalarials. Then anti cancer. तो एंटी कैंसर में क्या ज़रूरी है? एंटी कैंसर में अगेन क्लासिफिकेशन एंड मैकेनिज्म. So classification mechanism, not all regimes are important, not all the regimes are important. So basically you can pick from the previous actually papers which regimes have been asked more often. So consider on that because every regime याद करना possible नहीं होगा. But remember the few regimens. And जैसे breast cancer बहुत बार पूछते हैं, ठीक है, Hodgkin's lymphoma पूछा जाता है. So you have important regimes, उसको याद रखो. सारी regimes याद करना मुश्किल है. ADRs, so anti-cancer drugs and the common ADRs which are there and their treatment. न्यूट्रोपीनिया है तो क्या देंगे, अनीमिया है तो क्या देंगे, थ्रोम्बोसाइटोपेनिया है तो क्या देंगे, दैट इज वेरी इंपॉर्टेंट. ठीक है, फॉर दी ADRs have been asked. Vomiting and nausea, vomiting में क्या देंगे, which antiemetic to be given, which antiemetic to be given later on, and so many radiation sensitization, which are the drugs which cause that. So there is like bleomycin induced flagellate dermatitis. So they have given you pictures or they have given you the ADRs and asked you to identify which particular ADR. So ADRs are important. There are certain specific ADRs. Not every ADR is important, but there are certain specific ADRs which you can see from the previous, and I will also be discussing with you when I take the lectures कि ये ADRs पूछे जाते हैं. So have more focus on that. But as I said, जो common ADRs है, make a list of that. That is very very important to know. ठीक है, तो ट्यूमर लाइसिस सिंड्रोम में हम क्या देंगे, न्यूट्रोपीनिया में हम क्या देंगे, थ्रोम्बोसाइटोपेनिया में हम क्या देंगे, अनीमिया में हम क्या देंगे, ये डेफिनेटली मस्ट नो. सिमिलरली जो ये टॉपिक्स हैं, द टू टायरोसिन काइनेज इनहिबिटर्स एंड मोनोक्लोनल, ये सिर्फ एक्चुअली दिस इज अ वेरी वेरी वास्ट टॉपिक, नॉट एडवाइजेबल टू नो एवरीथिंग, बट ओनली क्वेश्चंस व्हिच हैव बीन आस्क्ड बिफोर. जस्ट मेक नोट ऑफ दैट. It is not possible that you can know everything on this. It is just don't go ahead and do everything. Very few important ones जो पूछे गए हैं बहुत ज़्यादा in the previous papers. Just focus on that. And ये भी recent topic add हुआ है immune checkpoint inhibitors का, because it was asked this time, so it has been also added up for the need. So this can be asked again. Which of the following drugs is not an immune checkpoint? Usually they ask you not an immune checkpoint inhibitor. So there is a list of drugs which is an immune checkpoint inhibitor. And that is how you have to actually cross and arrive at a particular. So there are few drugs only, immune checkpoint inhibitors. There is a mnemonic to remember for that, and if you remember that mnemonic, you will know that kaun se other drugs are not the immune checkpoint inhibitors. Then the last one is your immunomodulators. Again, calcineurin inhibitors important है और thalidomide बहुत important है. Thalidomide, calcineurin inhibitors, these are the important topics to know. ठीक है. TNF alpha blockers, yes, a little bit about that. So that will be taken up when I discuss. So nothing in बहुत detailed हम नहीं करेंगे इसके बारे में. But ये जो दो हैं, out of these, if I tell you that these two are important, calcineurin inhibitor and thalidomide. Thalidomide is very very important because एक तो teratogenic drug है, इसके other uses भी हैं. So therefore this has been asked a lot of times. Right, so this was about the important topics in pharmacology. Okay, so ये top topics हैं, and top topics only mean that these are something, as I said before, that these are must know topics and you have to touch on them. You cannot go to an examination hall without doing this. It never, or I do not mean by if I missed out on something that it cannot be asked, but ये होता है कि ये तो आपको आना ही चाहिए. Everything else is very good also if you add on to that, because it is, we have a lot to cover, but at least ये चीज़ें ऐसी हैं which have been asked and which are so important, and you the scores जो है ना, if everybody is getting it right, you cannot get it wrong. That's the main focus कि अगर सब ये पढ़ के आ रहे हैं और आप ये पढ़ के नहीं जा रहे, you are losing out on the marks and you will go down on the rank. So इसलिए ये ऐसे topics हैं which you must know, whether it is next, whether it is NEET PG, topics जो important है वो ही important रहेंगे. So whether they ask you like this or whether they ask you like this, आंसर तो सेम ही रहता है. So whether they give you in a clinical format or whether they give you a direct question, answer doesn't change. ठीक है. So okay, that was all about top 20 topics. Right, I hope you could get a little idea about. I didn't make it a revision class because then I would miss out on all the topics. अगर मैं revision class लेती, then only few questions are discussed and the rest are left out. But here I wanted to give you an overview of when you sit down and start studying pharmacology. Please have this list with you and make sure that you have ticked this list. I have done this, I have done this, I have done this. Right? And definitely in the following months, we'll be coming up with videos regarding different I will taking up sessions on various topics, and there I will do rapid revision questions, and वहाँ पे we will try to solve questions and again revise those topics. ठीक है? All right. Thank you, Dr. Ritu. Thank you so much. So all of, if there is any query regarding these top topics, you can definitely go ahead and ask me, or else we'll sign off for the day. If you have any doubts regarding anything, regarding the top topics, or if I made myself clear, anybody who's missed out on joined late, you can just go back and watch the session again, so that you have a fair idea of what. So make notes, जहाँ पे भी आपके notes हैं, so make sure that you write all these pointers over there, and so that you know that you are on track, you are not missing out on anything, and you are actually going well with your preparations. All right, so there's no question. Thank you so much everyone for joining in, and I hope that you will study with this, I've given you some vision, and you will keep this in focus and study and prepare well and do really, really great in your upcoming examinations. All the best, take care, see you in the next lecture.